Yes, sir, you can start.
Mm. Good afternoon. Today, actually, we are going to talk on rabies vaccination. And one of the key important things we are going to talk is the TH rabies vaccine that is being installed from the Cadila Pharmaceuticals. Why this is very much potent, very much efficacious, and very good brand available in the market. Going to the rabies thing first, rabies is actually a very zoonotic disease, a disease which is actually spread from animals to humans, not only from humans to humans, but spreading from animals to humans. So the very important thing we go across is this is a very viral and deadly disease. The rabies disease is very much fatal, and the fatality rate, case fatality rate goes around 100% if left untreated. So from the public health point of view, if we say rabies is dangerous, but the thing that we must measure that this is preventable. This is curable because vaccination is the sole purpose of this treatment. So going to the main fact and promoting the novel 3-dose G protein vaccine, which is developed by the Cadila Pharmaceuticals, which is the TH rabies. So why rabies is actually a public health challenge in India. Globally, 59,000 human deaths actually occur, highest in India. And India actually has around 20,000 human deaths a year, which accounts for about 60% of the rabies deaths and 35% globally. So around 91% deaths actually are seen to occur from the rural India base. It was actually said that every 9 minutes, someone in the country is actually dying from hydrophobia or rabies, which in the Bengali term also we tell as Jolatanko. So, talking about the current management regarding rabies, not only for the treatment point of view, but from other circumstances also, the current management lies not only with vaccination but also with immunoglobulin treatments. What immunoglobulin treatments we give is actually the passive immunization, which is the rabies immunoglobulin, along with the active immunization, which is given by the vaccine. But primitively, when a dog or cat or rabies is also spread from monkeys, bears, wild boars, this can also help in spread of the rabies. So, on a technical basis, when a first dog bites actually a victim or a patient, what goes is the local own treatment. First, we must start with own management or own toileting, where we actually cultivate upon key factors like uh, you must under running tap water we must clean the affected area or the owned area under the running tap water, which is actually used as a first aid in this case. And then precautionary measure goes as yeah. Yes, yes, yes. Yes, yes, yes. So here we can see if the dog is actually biting. Here, where is this is the bite wound, where we must clean the wound for 15 minutes. You can see in the picture the rabies post-exposure prophylaxis. We must clean the wound over 15 minutes under the running tap water. And then we must promote the vaccination. We must strictly give the vaccination in such cases. In case of category 2 bites and category 3 bites, we must strictly give the vaccination. Whereas in case of transdermal bites, we must give along with vaccination rabies immunoglobulin. Rabies immunoglobulin from, has two kind of regimens. One is the most popularly seen in the SN regimen, the intramuscular regimen. For category 2 and category 3 bites, there are actually 5 doses given. One is the IM dose and another is the intradermal dose. The IM dose is actually the most preferred one, whereas intradermal is said to be the newer mode of treatment. For IM doses, we actually give the regimen on 0, 3, 7, 14, and 28 days, which is actually given on two sides. Okay. So, if we talk about national guidelines for rabies prophylaxis 2019, which is actually published, the key challenges for a post-exposure prophylaxis. What are the key challenges for a post-exposure prophylaxis? The key challenges for a post-exposure prophylaxis are actually non-compliance to the treatment. Actually, it is saying that people are actually very much non-compliant to treatment because this is a huge regimen. And the thing is, rabies immunoglobulin from the if we go to buy from the market, then people does not have the enough aids or the enough money to take it. So non-compliance to the treatment is actually a very heavier thing in this sector. Current rabies vaccines are actually cell-culture vaccines. So the chances of having an anaphylactic reaction to such vaccines are actually very, 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 very less. And inactivated vaccines are more than 50 years old technology. So what lies with the challenges in this sector are the availability because there is a short supply and adverse events to such doses are actually quite high. If anaphylaxis develops, like people can severely go into shock, or a transdermal syndrome can also occur, or a toxic shock syndrome can also occur. So inconsistencies potency lies as a huge factor in such cases. Talking about compliance with the anti-rabies vaccine, who are actually compliant with this vaccine? Who those who receive the full dose of the anti-rabies vaccine with scheduled doses on respective dates like 0, 3, 7, 14, and 28, they are actually said to be as compliant. Whereas there are cases who are delayed compliant, like those people who are actually suffering from immunocompressive diseases like HIV, AIDS, the people suffering from malaria, those who are on treatment for CKD, those who cannot complete the treatment within 60 days because the regimen can be extended from 28 to 42 to 60. So there is deviation in the treatment and there is delayed compliance. And there are also groups like dropouts, who are actually those dropouts who had taken at least one dose after the animal bite, but totally does not comply with the schedule because only one dose on day zero, which is the first dose of starting the vaccination, but on day 3, 7, 14, 28, no compliance with the vaccination. They are said to be dropouts. Now, talking about limitations to the food dose WHO recommendation. So, in various studies like rabies post-exposure prophylaxis done under review of new centers for disease control and prevention and WHO recommendations, a retrospective analysis has been done. A retrospective study is actually a backward study where already the result of the study has been or the outcome has already been done. So people just analyze with this study what actually happened for the drawback of such vaccination. A retrospective study among 110 clinical clients has been done, and it was found that there was late initiation of the post-exposure prophylaxis in travelers. Those people which are going to the endemic areas, those people who are traveling in a far area where there might be deadly rodents, the deadly dogs, cats. So there is a high chance of developing a post-exposure to the virus. So and these people generally do not administer the vaccine, and they actually take the vaccine on a later basis. So this late initiation of the vaccine can actually lead to the rabies death event. Administration of rabies immunoglobulin. Administration of rabies immunoglobulin allows lies as a drawback in such sectors, and it was for this reason it was also found that antibody levels are quite less in such patients. So conclusion is that people does not receive the optimal dose of post-exposure prophylaxis. So and to non-compliance to 5 doses. What are the proven causes? There are various cases actually taken up, like a 58-year-old female, a 38-year-old male, or a 34-year-old male also bitten, all taken up by a street dog, where 3 doses of the vaccine has been given, but it was compliantly found that in case of some outcome, the patient survived after only 16 days, but died after 1 day of the lama because the patient was actually non-compliant to the treatment. non-compliant to the vaccination and non-compliant to immunoglobulin take. Lama on the same day of the admission and death followed by 2 days, which expired on the second day of admission. So the most important cause that comes out in spite of vaccination or in spite of uh, mm, some partial compliance is that the lack of administration of the immunoglobulin. Lack of administration of the immunoglobulin, and there is poor compliance to the vaccination. Mm. And there is poor compliance to the vaccination. So there was a good study done as a hospital-based epidemiological study, where actually this is actually a cross-sectional or ecological mode of study where there is compliance to post-exposure prophylaxis done at the very primitive hospital in New Delhi, which is the Safdarjung Hospital, and with a very good population, which is around 360. And this proved that 53% are actually non-compliant to the full course because this is a long regimen and people are very much reluctant to take vaccinations on such schedules because they had to come there to take the vaccine, again they had to come there to take the vaccine. So this causes a delayed compliance and sometimes even non-compliant to the vaccine. Talking about another case where there is compliance to anti-rabies vaccination and post-exposure prophylaxis done at a municipality cooperation hospital in Bangalore among 215 animal bite patients, it was found that one dose of the vaccine was administered intramuscularly on 0, 3, 7, and 28. All measures and compliances and constraints are also taken into the account, and it was found that actually seeing the graph, the bar chart, we can easily realize that the compliance rate for the intramuscular vaccination was around 60%, which was quite high. Okay. And it gradually from day 0 to day 28, if we look at the graph, it gradually decreased. When it was for the day 28, people are very much reluctant to come. These are actually the chief causes why the anti-rabies vaccination, according to SN regime, actually failed to capture the market. So, out of these compliances, if we try to compile upon why the complete course of anti-rabies vaccination was actually interfered. This was shown by a good pie chart here. The major constant that we find out is the loss of wages, which is around 47%. Please go back to the next slide. The next slide, yes. The major constant for the complete compliance to the complete ARV was around the 47%, which is actually for the loss of wages. Because people, whenever they approach a health facility for vaccination, chiefly either for a routine vaccination or a COVID-19 vaccination or any kind of anti-rabies vaccine, they thought that they are going to get the vaccine on a free basis. But actually, this does not occur. So the loss of wages and impartial treatment are actually a bigger cause in this issue. Next, next. This is the evolution of the rabies vaccine. If we talk on the evolution of the rabies vaccine, it began in the early 80s, where the live attenuated vaccine are actually made from the spinal cord of the patients who are actually suffering from rabies. And actually, these vaccines are actually nervous tissue based or the neural tissue based. And so in 1977, what taken upon is you change the matter from the brain, from the spinal cord to the brain, which developed and resulted in development of anti-rabies or inactivated vaccine, which is brain up to 10%. And finally, we improved upon this because there are high chances of anaphylaxis, anaphylaxis reactions occurring, like tenderness, like erythema, like ecchymosis. So the cell cultured vaccine, which are actually inactivated vaccine, it was found that they are very much non-compliant and very much compliant to the today's date from 31st dose to 5 doses and still on, which is actually given as 0.50 ml daily on 0, 3, 7, and 14, and intramuscular given. Next slide. Now we are meeting the unmeeting demands of the medical need, introducing the first novel vaccine with the simple and shorter regimen, which is TH rabies. Why TH rabies is actually so much potent in this era? need change. Yes, this is the novel three-dose recombinant G protein vaccine. Why are we talking about the novel three-dose G protein vaccine? Because any kind of protein vaccine, when we derive from the viral DNA, either RNA or a DNA substitute, is very, very potent. And recombinant means we develop the same kind of vaccine that in other animal cells in combination with a toxoid, in combination with another kind of protein or a substitute. And when we develop such vaccine, these vaccines are actually rather have a high level of efficacy, and these are actually showing very less, in fact, no anaphylactic reactions, or no, in fact, there is no requirement for testing the vaccine. So this is actually prepared from the VLP platform technology. VLP platform technology is one of the utmost technologies available in the country, which are actually used by Cadila Pharmaceuticals, and they developed the first vaccine with the intramuscular dose with a shorter regimen, which is for which the compliance factor does not arise because patients are taking only for a limited dose of time, like 0, 3, and 7. And this is actually utmost regimen compared to other regimens which are developed by WHO previously. And there is better compliance with this easy flow regimens. And what is the convenience we talk about? There is no need for reconstitution. Most important thing. Next technology, if we say about the VLP technology, this is the VLP technology. The viral genome, we have the native virus and we have the G protein. Then we combine the virus-like particles, which are actually nanoparticles complexes, which actually strengthen the inner vaccine module. And these are similar particles which does not actually alter the native virus but make the viral protein very, very potent so that they cannot replicate and they cannot mimic the antigenicity, and thus they produce a stronger immune response. And if a vaccine is actually able to produce a stronger humoral and cellular response, this goes as a most dedicated and a perfect vaccination strategy. So VLPs along with the G protein make the technology more simpler, and that's why THRBs is promoting the vaccination. Now, going to the clinical phase 2 trial. In the clinical phase 2 trial, we have study design, which is actually a randomized control trial done among few patients based on 10 microgram doses and 50 microgram doses, which we have also Rabipur vaccines, which are compared with this, which are given on 0, 3, 7, 14, and 28. So this revealed, as we kept on increasing the doses, but shortening the regimen on 0, 3, and 7 days with a participant view of only 15. And these patients are actually maxed. In case of phase 2 trial, which is actually seeing upon the efficacy of the treatment, these patients are actually maxed and given a higher doses, but a shorter regimen. So if we're going to see the chart, actually the bar chart, if we're going to see the bar chart, comparing with the Rabipur, so we can see that this is highly efficacious. The TH-reduced vaccine are the highly efficacious and giving an important seroprotective factor. The 50 microgram is giving an important seroprotective factor. What is the seroprotective factor they are giving? This is nothing but the stronger immune response they are showing. The antibody levels are actually very much high in the patient, and this is giving a protection for more than 3 to 5 years. So, the next step, let's change it. The clinical study phase 3. In the clinical study phase 3, this is just for the post-marketing surveillance which it actually does in the market. So this studied only the safety, the immunogenicity of the vaccine, the new vaccine we developed, the recombinant vaccine, under a randomized comparator control multicenter phase 3 trial. This was actually done by various authors around the country, and this is with the help of human vaccines and immunotherapeutics. These are done and published also. So what it revealed, the phase 3, the phase 3, please change it to the phase 3, please change to the phase 3. Phase 3 trial, please change.
Ma'am, please change.
Anyone from tech team?
Please change. Please change.
Yes,
Anyone
sir.
from tech team?
Next slide.
Please
Next
change.
Yes,
slide.
sir.
Please change.
Next slide. Yeah, this is to evaluate the immunogenicity and the safety of the vaccine. This was actually done among the higher number of participants compared to the phase 2 trial, which is around 80. 80 participants, and 80 participants are actually grouped upon and matched according to the RCT, which is done. The comparison with the Rabipur, which is taken as the reference or the gold standard. The TH rabies, we can see if it was given for a shorter period of time, but with the higher doses among 533 subjects, it was found to be more potent than the Rabipur vaccine, which are actually varicella cultured vaccine. But this Rabipur are the purely cell culture derived vaccine, and which are giving higher potency compared to the Rabipur. So finally, we come to the results. Change the slide. Finally, we come to the results. In the results, we talk about two things, mainly efficacy and safety. The results will come about two things, mainly the efficacy and safety. How we measure the efficacy is through the seroprotection given by the vaccine on the last day, day 42. In talking with the Rabipur vaccine, the seroprotection rate for the TH vaccine was actually very high, which was compared as 99.24%. Whereas in case of also TH rabies, the chances of adverse effects which are measured in the division of safety. The TH rabies vaccine actually put a lower number of adverse effects compared to the rabies bull vaccine, such as people developing fever, people developing convulsions, people developing erythema following vaccinations are actually quite less. So even local adverse events, systemic adverse events like ear pain, fever, headache, urticaria, all developed are actually very less compared to the uh, Rabipur vaccine. So there is a high observed difference when you see the 95% confidence interval rate. It was around 1.5%, which is actually giving a higher protective rate compared to the other vaccines. So next slide, conclusion. Starting to the coming to the conclusion of the point which are actually talking about. Please change it. Please change. Uh, change. Change the slide.
Hello, tech team. Hello. Is there anyone from tech team?
Change
Sir,
the
I'm
slide.
not sharing the slide, sir. Your Kirila
Yeah, we're
ma'am
coming
is
to the
sharing the
conclusion.
slide, sir.
Okay, okay. Okay. Ma'am, Paul ma'am. Hello.
We're coming to the conclusion.
Paul ma'am. Okay, sir, you continue, sir.
Yeah. If we go to the conclusion, then we can actually derive out what actually we derive out compared to the Rabipur vaccine is the novel three dose with the G component with the G protein recombinant factor was actually very much superior compared to the reference vaccine, and the chances of adverse effects also are comparatively very less. So, from the immunogenic and also from the safety point of view, and in combination with the WHO doses, these vaccine proved much lot better compared to the Rabipur vaccine. So, if we it was found that if the higher dose and with the lower treatment regimen, it was able to protect, it was able to give a seroprotective factor higher for than the Rabipur vaccine. So, these are actually the pharmaceutical. Can we change the slide? Next slide, next slide. We have gone to the conclusion. Next slide, next slide. Yeah, to the conclusion, we have already defined the conclusion of this here. Okay, can we move to the next slide? And these are actually the awards which are gone through by the THREV is the Cadila division, the Pharma Innovation by the Economic Times, and also the Innovative Product of the Year by the Malaysian Golden Globe Tiger Awards was also given to the THREV vaccine. This THREV vaccine does proved to be very much efficacious, not only for the safety point of view, but also giving a higher seroprotective rate with a very, very short regimen. This is very much important for us. So thus we come to the end of this chapter. So rabies is a very deadly disease, must be protected through vaccination and immunoglobulin treatment. Otherwise, preventive but 100% fatal. Hydrophobia is a notifiable disease. Keep notifying us and keep supporting TH rabies. Thank you.
Thank you, sir. I just want to know one thing. Is it our 3 dose anti-rabies vaccine? It is good for your patient if I compare with 5 dose.
If we compare with the 5 dose, it was according to the RCT trials or the comparison with the Rabipur vaccine, which is also a varicose culture vaccine. It is seen that actually the seroprotective rate was actually very much high, and the adverse effects also are very much less. So it can be used as a good potency. And actually, general practitioners might recommend this vaccine on doses of 0, 3, and 7. And thus, results are actually very much electrifying. So,
Okay,
these theories can also be given.
okay, okay. Thank you, sir.
Mm.
Thank you for your support, sir. In
Yes, sir.
our in other brands also. Many
Yeah, yeah.
thanks, sir. Continuing, sir.